Reported the shortness of breath at rest shortly after the catheterization. The 17th, there was the initial diagnosis of pulmonary edema. Interstitial markings have increased since previous of 2 days before, since admission. Okay. And February the 18th, he writes, stable for now, shortness of breath associated with stress, not heart failure. This is while he's surreptitiously tracking the lab.
So that's where we get into problems. This is where we kind of get problems.
This is where it gets funky.
Anxiety. Yeah. I had somebody post-angiogram whose blood pressure was going down. I would not usually think of psychiatric disorders. If you have a sudden increase in the amount of regurgitant blood in the left ventricle, your ventricle can't comply with that and you get sick. You have edema.
Abdominal edema, basically sitting over a toilet, vomiting repeatedly.
And you didn't have that before the angiogram. Yeah.
So many issues.
That's not psychiatric. You had the findings. Key for me is that you have the development of interstitial edema on your chest X-ray.
Mm-hmm. He's claimed that there were no complications resulting from cardiac cath, but he was tracking the complications.
The blood work that you show, that's hard to explain otherwise.
He was tracking it through the BUN to COR tests that he arranged in advance.
Yeah.
So
you would know. I mean, anxiety and stress doesn't do that to your BUN. You're volume overloaded. Acute renal failure and not responding to diuretics.
One of my friends is a specialist medical doctor. She said that the physical changes are audible by a stethoscope.
Yeah. The changes of the fluid on the lungs and the other changes, that's hard to explain away. They should have had a different explanation other than anxiety. They should just come in. Told you. That would have, you know what I mean?
They knew. He was making money off invoicing the BC Ministry of Health for psychiatric services.
Right.
Because had he arranged immediate surgery on the 16th when I went into shortness of breath at rest, he wouldn't have been able to invoice.